When we think of estrogen, a lot of times we have vaginal dryness and hot flashes and stuff, but a lot of people might not know that if you have night sweats, anxiety, that's usually related to low testosterone levels. So they're interconnected, and testosterone turns into estrogen. So a lot of times they're both abnormal.
Hi, welcome to the Regenerative Warrior Show. My name is Dr. Ross Carter. I want to welcome our special guest, Jaclyn Shedden. Welcome to the show today.
Thanks.
So today we're going to talk about something very interesting, which is testosterone, but not in the way that we normally think of it. Most people, I would say, believe that testosterone is just a primarily male-only hormone. Is that kind of the accurate thing that people believe? Or am I off?
Yeah, I think we hear a lot with testosterone in relation to men, especially when it comes to athletes and bodybuilders and stuff. And a lot of times we don't really connect it to females.
And so you're saying that women also can have problems with testosterone that could lead to some issues, correct?
Yeah, huge. I mean, testosterone plays a really big part in women's health in regards to bones and brain, breast tissue, also with fatigue, sex drive. Obviously, that's what everybody thinks about when they think of testosterone, but also anxiety and sleep. Testosterone plays a really big role in that as well.
So does testosterone also it affects the sex drive of women as well?
Oh, yes, of course. Yep.
Interesting. I did not know that. So it doesn't make what does it do exactly? How does it affect a woman?
Well, I mean, similar in the way it affects a man. When your testosterone is low, you're going to have a lower sex drive. Now, you might not be able to climax as easy as well. With men, it's obviously more obvious and it's a lot more common. People talk about it all the time. We see commercials for Viagra. And women really do need higher testosterone levels to get their sex drive back, especially, after children when our hormones are affected so badly. And, a lot of times we don't recover from that. And once we may have had a sex drive, a very healthy one prior to having a child. And then afterwards, we just don't get that back.
And that could be a problem because of a testosterone issue and not just an estrogen problem or something like that, when other hormones that could be affected as well. Is that right?
Yeah, I mean, when we think of estrogen, a lot of times we have vaginal dryness and hot flashes and stuff, but a lot of people might not know that if you have night sweats, anxiety, that's usually related to low testosterone levels. So they're interconnected, and testosterone turns into estrogen. So a lot of times they're both abnormal.
I learned about that. I remember when I used to take HRT, testosterone, and then my estrogen levels went really super high, and I couldn't understand that. I was like, why would my estrogen levels go up so high when I'm
Yeah.
taking testosterone? But as you said, it gets converted,
Yep.
and so I had to take a blocker
hmm
to an astracine or something
An
and
astrozole,
yeah, that's
probably.
it.
Yeah.
And
hmm
it helped to lower down the estrogen because I was having some major hot flashes. It was
Yeah,
not
you can
fun.
get pretty moody, with estrogen levels. You don't want too low of an estrogen level in men either, though. But and there's a supplement called DIM that I use with my patients
Made out of
all the
broccoli, isn't
time.
it?
Yeah, it's been around for a long, long time, and it's good for men and women. And whenever I have somebody on hormones, like pellets in particular, I always have them take DIM, and
Now,
that's
are you just
really
talking
been
about like the
successful.
nutritional, or is there like a prescriptive?
Oh no, just the supplement. Yeah, and then if somebody really isn't metabolizing estrogens, then they would need a prescription. But overall, I mean, most people do fine with the DIM.
So, how does a woman really know if their testosterone is their primary problem and it's not another hormone?
Well, obviously, the best thing is going to is to be tested. So you need to have your testosterone level checked, and that's going to be the most obvious reason. A lot of people may come in with complaints of fatigue. They also, you want to include a thyroid panel in that too, but making sure that your testosterone level is optimized is key.
When a woman goes to a doctor, do they typically check the testosterone levels?
I would say no. A lot of the patients that I've seen, even ones that have been on hormone replacement, have never actually had their testosterone levels checked.
Uh-huh.
Again, because why we're talking about it, because a lot of them may not think that it has anything to do with how they're feeling. So it's
Exactly.
super important to have that level checked for
And
sure.
what is a level that is where you want it to be as a woman? Or
I mean,
is there
that's a tricky question,
okay.
because some, the reference ranges, the expected reference ranges on a lab panel range from 3 being normal all the way up into the 40s being normal.
Oh,
Now, if they're on hormone replacement and they're on, specifically pellet therapy, their normal is between 150 and 250 once they're on treatment.
okay.
So, a lot of women have symptoms if their testosterone level is under 20. Some even if it's even if it's above 20, they might have, some symptoms from low T. So,
Hey, this is Dr. Ross Carter again. Listen, if you're a doctor or a medical professional or interested in adding exosomes to your practice, or if you're actually a potential patient who's interested in exosomes, I want you to listen. Now, the company that we're recommending, I have an agreement with. Basically, I refer them business. Now, I would rather, if you're getting exosomes, make sure to get it from an actual company and not a distributor. So I'm not, doing it that way. Basically, I'm just referring you to them. But if I do refer them to you or you to them, basically what you'll get is not only will you get product from them at the best price you can get, but you'll also get an additional bonus of free amniotic exosome products as well. So what that means is if you order the placental exosomes, the MSC exosomes, you'll get in addition for free amniotic exosomes absolutely free. So if you're using amniotic exosomes, you're already paying for those, and so you get a vial of those for free with purchase of the MSC exosomes, and hopefully you see the difference in the value by now. If you're a patient and considering this and you think, hey, I'd like to do this procedure, all you got to do is you can contact me and I'll send you places that could be close to you. So here's how to contact me. Just send me an email at drrosscarter@gmail.com. That's DRROSSCARTER@gmail.com. Or you can call or text me at 561-962-1231. That's 561-962-1231. So either email me or text me or call me. It's just best to email or text me, and I can get back with you with that information. So if you're considering this, let me be the reference point, and it helps to support the show. Obviously, I get a benefit if I refer you. So I want to be transparent about that. So please support the show and email or text me, and I can get you connected and give you the best prices. Plus, a special is you're going to get additional amniotic fluid exosomes for free. Can't beat that. So I hope you continue to enjoy the show. I'll let it continue. Here you go. Wow. It's just never a topic that I even thought about, that women's testosterone levels could have such a dramatic effect on their health. So normally when you're looking at somebody, especially a woman that's having energy problems and things like that, what are the hormones they should have like checked in general?
So they should always have, a full hormone panel, which includes testosterone, estradiol, progesterone, and an FSH. You can also do an estrone level. And then I always do a full thyroid panel as well. which includes a free T3 level, TSH, free T4, free T3, and then a thyroid antibody. And you can also throw in a reverse T3, but that's getting a little bit deep. And then a vitamin D, B12, and folate. I always check all of that on a patient when they first come in, just to make sure that they're all balanced. And I haven't found one that has all those balanced yet.
Well, what's the most common thing? What is the most common thing you see?
I see a lot of hormone imbalances, whether it be estrogen dominance, low progesterone, and low T, and then thyroid imbalances as well.
Now, when you see problems with the estrogen levels and the progesterone levels, what is it that you're using to help to improve that?
So I can use DIM, to help metabolize the estrogens a little better. There's some other supplements that I use that are a combination of a bunch of things. And then I can, compound progesterone. And depending on whether they're, have low progesterone levels and high estrogen, I'll work on metabolizing the estrogen out of the body safely. And then, compounding the progesterone, and they can take that depending on if they're having a menstrual cycle or not. They can cycle that on days 14 through 28 of their cycle, which is going to mimic what their own body would do. And then if they do have low testosterone levels, I have a lot of women that are, in their 40s, some in their 30s, and they're still getting menstrual cycles, but their testosterone is really low. So I can treat them with hormone, just, testosterone therapy via a pellet. And that really gives them back, the life and the vibrance that they're really looking for after they've been, after they have their testosterone optimized.
And for those people who are not familiar with pellet therapy, tell me about that.
So pellet therapy is bioidentical hormone replacement, and it's, based from plants. So it's basically a small pellet, which is about the size of a piece of rice, that goes under the skin and lasts for about 3 to 4 months. And the great thing, a lot of people have heard about hormone replacement, but may not be familiar with pellet therapy. So there's creams and there's patches, and the best and most effective way that I've found over the years is pellet therapy, because you get a steady flow of the hormone through the body throughout the day. So there is no problem with absorption, application, user error. You get the pellet placed, it's there. It doesn't come, it doesn't come out. It stays there. It gets absorbed through bloodstream and cardiac output. And then, about every 3 to 4 months, you need to come in and get it replaced.
And how do you make sure that it's not giving you too much or not enough of the testosterone? How can you?
So I'm a certified BioT provider. So BioT is the leading educational resource, and they train all the providers in the country. They have several thousand that they've trained over the last 5 years. So we have a dosing site, so we can scientifically dose the patient based on their blood work and extensive questionnaires, and interview with the patient and symptoms. So it's very specific to the patient of what dose we give them each round. And then we also do follow-up blood work to make sure that they're within the range. So
gotcha. And how long or how quickly does a patient usually notice a difference?
So the testosterone gets in the system in about 7 to 10 days. So
Okay.
a lot of patients will start to feel maybe a little bit more energy. That drag in the afternoon isn't as bad. They're not reaching for the coffee at 3 in the afternoon. They're sleeping better. Their anxiety and stress level, they're not as, angry maybe when little things go wrong.
It just sounds kind of opposite. You think you're taking testosterone, which typically you think is more the aggressive hormone, I guess, and
Yeah.
you're less anxiety and less aggressive.
That's just more media based. We see that with bodybuilders and rage,
Right.
with
Right.
the testosterone, but it's actually a very calming testosterone, and super protective for the body.
Yeah, because I would think, like, when I remember, like, would work out with a woman, and she would say, "Well, if I work out in the gym, I'm going to get muscles, and I don't want to be big and bulky like that." And you're like, "That's not how it really works."
No, I mean, if you're going above and beyond, you don't ever get something like that with the hormone replacement like pellets. You can tone up a lot better and build muscle mass, because a lot of times as we get older, we're not able to actually build muscle mass
Right.
as well as we used to. And so this really helps bridge that gap.
But you're not going to look like a professional bodybuilder after you put this in.
Absolutely not. Oh yeah, they're like, am I going to grow a beard? Am I?
Exactly.
Well, we've seen it so much in movies, so we tend to believe it. But no, this is completely safe.
Funny. That is so funny. Yeah, I've heard all that before. So that's why it's fascinating to learn that testosterone can be low in women as well, and not just men who tend to have a problem with it. Do they? Can they? So are creams also something that can be used, or just the pellets?
Yeah, creams can. There is no oral testosterone that
Okay,
you could take like there is estradiol. So yeah, you can do creams. You can also do troches, which I've done, for my patients,
troches.
which troches, which just go in between the cheek. They kind of dissolve like a lozenge.
Oh,
Yeah. So that's also an option too. But over the years, I've really tried to just educate the patient as much as possible on going to the pellets because the ranges, the levels that, that we get with the pellets is just much better.
and how do you get the pellets in?
So you make a small, so you numb the area with lidocaine and
What
you make a
area do you
small
usually put it?
incision. So we use just the hip buttock area, top of
Okay.
the butt cheek. Yeah. And you switch sides each round. So the pellets dissolve, within about 6 months, 8 months. So
Can
you
you feel
switch
them?
sides. No, not generally. You can't. I mean, the men get a lot more pellets than the women, and if you really dig around, you can probably feel it. But
There's something there.
but they're quite small. So yeah, you just make a small incision after you've numbed the area. You place the pellets in with something called a trocar. They go in very quickly. It's a very simple procedure. There's no stitch. I put a steri strip on top, a sterile gauze, and a clear dressing, and they can take it off in 3 days. And you just can't exercise for 3 days or get it wet so that it heals.
Understood. Understood. Well, fantastic. That's good information. Thank you so much for that.
Yeah, no problem.
So if so can you now where are you located?
I'm in Tampa, Florida.
You're in Tampa, Florida.
Hmm.
Gotcha. So if a woman is interested in learning more about this procedure, but do you do anything remote, or do you just do only internal like consults and stuff?
So, I mean, for my general practice, I do virtual appointments. But for the hormones, no, you have to come in and be seen, obviously, because of the procedure. So,
Well, to insert, I mean, you could test them remotely, right?
yeah, like if they lived in Florida and they wanted to get blood work, then I could obviously order the blood work prior. And I offer the 20-minute free consults too for anybody that just wants a little bit more information on that.
And tell us how they can get that.
So you can go to my website. It's blueskyhealth.com, and sky is spelled with an E after my daughter. Or you can also
Okay.
go to jaclynshedden.com. They'll both take you to my office website.
Perfect. Well, that sounds fantastic. I think you've answered all my questions and very interesting. Anything I missed?
The most important thing I would say is just to get your levels checked. And if you can't find somebody, if your doctor that you have right now won't check them, then just ask someone else. It's really, really
Isn't there
important
some
not to
online
suffer.
services that could possibly,
Yeah.
do
Yeah,
you
there's a
know?
lot more stuff now. I don't know, like I think I'm not sure of like some of the ones that would do hormones off the top of my head.
Okay.
But maybe like lab tests now sometimes. Like
Any lab test.
yeah, there's definitely some more options, but the key is just a lot of people they know there's something wrong
Right.
and they've been told that everything looks normal for years, sometimes decades, and they're suffering. So it's just about connecting with the right provider and just being heard.
That makes sense. Beautiful.
Yeah.
Well, Jaclyn, thank you so much for your time today. I think that was very informative. And give your website one more time.
Yeah, it's blueskyhealth.com, and sky is with an E.
Excellent. All right, that'll work. Thank you so much for your time today.
I appreciate you having me on.
Thanks.